Now, the social service sector has seen results in its rapid adoption of technology to fight COVID-19. But as today's SG Pulse finds out, factors like infrastructure and vaccination will still be key as the virus turns endemic in Singapore.
This new robot in Tai Wah Kwan's nursing home in Hougang was designed for doctors to remotely check on patients to reduce physical contact during the pandemic.
Wave again.
But there are plans for family members to use the robot too, as virtual visits become more common. It's a new normal the nursing home envisions with an endemic virus.
With all the current changes implemented, enabled really by technology and the whole digital transformation piece, I do not think we're going to go back to doing things the old way. I think we'll have to leverage on technology even more. We'll see even more integration of technologies, and it should be easier to use.
But technology can only do so much. An endemic virus may be less threatening, but it can still spread easily, especially in nursing homes where residents live in close proximity. This may cause them to fall seriously ill. Experts say having single rooms can help with infection control.
In a ward arrangement, and not only bedroom but bathrooms, and they share dining areas, as well as the caregivers that are rotated to different wards. The chances of infection is obviously lower in the single room and dedicated caregiving arrangement because virus basically thrives on close contact.
Apex Harmony Lodge, which cares for those with dementia, has 2 and 5 bedders with their own bathrooms. This makes it easier to segregate residents during the pandemic and may be taken into consideration for future homes. Residents will not need to mingle for essential activities, and outbreaks can be contained as early as possible. These are key when living with an endemic virus. For existing homes that cannot renovate their dormitory-like spaces due to cost and space constraints, the principles in a pandemic will remain the same in an endemic.
Almost like the safe distancing measures that we're experiencing today, with really limitations in the number of persons who can gather together. These are all the kind of public health and behavioral measures that can be taken to reduce the risk. And of course, it's impossible to eliminate risk, but an outbreak that affects 10 residents is much easier than one that affects 100 residents.
Getting staff and residents vaccinated remains most critical. Employers may now make vaccination mandatory for those working in high-risk settings such as residential homes. Such guidelines are not for residents for now, but they could be in the future, given that COVID-19 is here to stay.
That is a distinct possibility. I would suspect that the system will not be so absolute, but certainly the non-vaccinated residents will be subject to much more rigorous testing. And this will have implications both on the comfort level due to regular testing as well as the cost implications.
He adds that the prospect of that may spur more residents to get vaccinated.